Hi guys, I'm Michael from SpineWise, and today I'm here to talk to you about the causes of reflux. Okay, now for those who know what reflux is, it's an inconvenient thing. A lot of people have it maybe once or twice off, but a lot of people have it on a repetitive thing and becomes a real nuisance for them, which requires intervention. So maybe firstly, just quickly go through what people might experience if they're getting reflux. So most people get this bit of a chest pain through here, can be a burning sensation through the chest. This actually can extend right up through the chest, can even go into your jaw. So be really careful of that one, because that obviously can mimic heart attacks. So just be mindful that that's not the problem first of all. But with reflux, a lot of chest pain through here, can occur generally, can more commonly after meals, can occur when in bed at rest as well. So two common things where it does happen more regularly: after eating and at bed at night. With that, sometimes you can also get a cough, like a bit of a persistent cough with it. You can also get difficulty swallowing, or even like a laryngitis, like a sore irritable throat, and your voice changes and things happening as well. So quite a collection of different symptoms, and maybe they're some of those things where you have one or multiples of those. Some people have just the sore throat type aspect with it. So it's an interesting combination that can be there. So what are the possible causes of reflux? And maybe let me explain maybe what can cause, what reflux is. So what it generally is, what we're looking at is in the human body, we've got the esophagus, our food coming through our mouth, down through the esophagus, into our stomach through here. Now what we've got at the top of the stomach here is there's a valve just through here, which doesn't come up very well with that one. Let's go to that. That might make it a bit better. Okay, so and there's a valve right at the top of the stomach there. It's called the gastroesophageal valve. Really long name, really important though. So it's a tonic valve. So what it is that what that means is as the acid levels in the stomach start to go up, then that valve is meant to close over and obstruct any of the contents coming back up the esophagus. So what we're seeing though is then with reflux is people are eating, they've got a food full of belly contents in there, the active enzymes start to action, things are happening, the body's trying to break down, get access to the micronutrients in food. They then start to get food repeating back up here. So you may even get to the point where you're getting food back in the mouth, or even like a sour liquid coming into the back of the mouth as well with it. So this gastroesophageal valve is really, really critical in this process. So what are the possible causes that it can affect this process and cause this reflux to happen and to come back into the throat? First of all, I've got postural on there, so this is really important. So with people, they can have a full belly, and it could be because of the type of food though. It could be really rich, could be lots of alcohol and things, which makes the processing in the gut more complex. But then if they slouch, you have a big meal, go sit on the couch. If you start to think about the contents of your stomach then getting squished when you're being lazing down, maybe sitting in a couch and then getting jammed up, you can get food contents pushing back up and maybe then jamming up against that esophageal valve and pushing back up into the esophagus and back, causing that discomfort through the chest. So posture is really important. And one of those things you can do quite readily is, again, don't sit down directly after a meal, maybe walk around for a little while, get your food to process before sitting on a couch. And if you do sit down, maybe be really mindful of your posture and how you're sitting. And even things like this with people who are sensitive, they talk about in bed, having an inclined posture in bed to not allow the food to sit in the stomach so much, to again help the food get processed through a little bit quicker. The second thing I've got listed here is a hiatal hernia. What that means is that part of the stomach can get forced back up through that gastroesophageal valve. So it's like there's a valve there and the stomach gets caught up in there. What that means is that then, because the stomach is getting caught there, the esophageal valve can't fully close over, can't close the contents off, can't seal the stomach contents in there. So again, you're allowing food to regurge. That's something that if you have ongoing cases of reflux, that may be one source of things they go and investigate and make sure that's not an issue for you. Because that's something, again, to understand whether it's something that's resolvable or something you're going to have to manage longer term. So hiatal hernia, second one we can look at. Now, third one, stomach acid. Now, this is really interesting. Like I mentioned right at the start, this esophageal valve is a tonic valve. What that really means is as we start to eat, as we start to consume food, the stomach starts to activating acids, and the acids are designed to make a protective environment for the body so that any food coming down is not conducive to bacteria and things like that. So the bacteria should die in that acidic environment. The actual acid itself doesn't break the food down though. It's the acid level rising up that then activates the enzymes to start cleaving the food down. So as the food comes in, that becomes, I suppose, more heightened. The thing is, as that acid levels come up, then this valve here should close and constrict and lock off the esophagus. That's what it's designed to do. So a lot of common theory is that the acid levels are too high, and that's what's causing the pain and discomfort. What we generally find is that it's normally that the acid levels are too low. So the problem is, because the acid levels aren't raising up high enough, we're not getting that valve to close, so it's staying open. That's allowing the contents to regurge up. That's causing the pain in the chest. That's causing the problems into the back of the throat, the food or everything coming back up. So it's that lack of function, or the acid level is not rising high enough. So the problem is, I suppose, protein pump inhibitors are the common treatment modality for this. That will reduce the acid levels even further, and that's, I suppose, will reduce the symptoms, because if you keep lowering the acid levels, then you are going to stop the symptoms. Doesn't stop the problem possibly, doesn't then also help what's happening further downstream, because those acid levels are so critical to our stomach function of breaking the food down, activating the enzymes to start cleaving up so we can get the nutrients as it passes into our small intestine. So that acid level is really critical in absorbing our food, and also that acid level, as it rises, sets this tone here, but also talks to the pancreas and the liver and starts releasing enzymes into that small intestine area to start ready to absorb and take those nutrients in, which is what we're looking for to regenerate and survive. So the stomach acid, again, is sought to suppress. We generally look at it trying to increase that stomach acid, get that acid level functioning up, and then get the tonic acid, the tonic valve, to then close over and do what it's meant to do. And there's some really simple vitamins and minerals that help that pathway that can make a significant change there. Now, the last thing I'm going to talk about today is the vagal nerve. Okay, the vagal nerve, I'm not sure if it's the vagus nerve, people may have heard of. It's a really critical nerve, comes out from the back of your neck, passes down, does a really important job of moderating heart function. It then comes down and controls stomach acid into the gut, controls stomach function. It then continues further downstream and controls small intestine and large intestine bowel movement. So really critical in that whole gastrointestinal system. So if that nerve gets entrapped somewhere, so that's getting caught, or somewhere its function's being impeded, then you're going to have reduced activation or function of that nerve into the gut, not firing up, not causing the activation of the acid, not causing those levels to come up, and then not causing that tonic valve to close over. So there's a couple of 4 different things that can cause, that is have an impact on reflux. Some of these things are really good, you can moderate straight away. It's like postural stuff you can adopt and start using straight away. And even the stomach acid stuff is something you can, there's things like zinc and B6 can be one of those things that can be useful in supporting that. And with the vagus nerve, that's a functional thing. There's certain, again, even vagal exercises you can do that will up-regulate that function and help its term. There's little things like singing and gargling, and even there's called ice therapy or cold therapy that can work. There's a guy called Wim Hof who's revolutionised this, or led the way in the research behind it. So if you're looking for something on even the vagal nerve support, Wim Hof might be a guy you can look at. All right, any questions on any of the content, please fire them up, and we'll again talk to you soon.